I welcome everybody to class, and today we'll be looking at vitamins. So under vitamins, we'll be looking at the different subtopics under vitamins, since as this class promised to be so exciting. Alright, so under vitamins, we'll look at the definition, we'll look at the difference between essential and non-essential vitamins. We'll look at the difference between water-soluble and fat-soluble vitamins. We'll look at the difference between hypervitaminosis and hypovitaminosis and its effect. Then we'll look at the different vitamins in particular. So that is what we'll be looking at today. Okay, without much ado, let's dive straight into the definitions. Now, vitamins are organic compounds which cannot be synthesized by the body and should be gotten from external sources like maybe food, fruit, vegetable. Pay serious attention to this. So vitamins are organic compounds that cannot be synthesized, can and cannot be synthesized by the body, and should be getting or must be getting from external food sources such as such as food, cereals, vegetables, and fruits. Okay, now one thing we need to know about vitamins is that vitamins also aid in the formation of coenzymes, and coenzymes aid to facilitate the working ability of enzymes. And in the absence of coenzymes, the productivity of enzymes will be so slow. So vitamins play a vital role in assisting in the catabolism and anabolism of many things in the body. And lastly, we have to understand that vitamins play an essential role in growth, maintenance, metabolism, building up of bones, strengthening the immune system, and all the like. So we need to come to a compromise where we understand that vitamins play a vital role in our body. Why do I emphasize on this? Vitamins are like the underdogs of medicine. They are not given the position which they deserve. Most often they are neglected. Most often they are not considered important until we start facing the symptoms. And you don't need to wait till you start facing the symptoms before you take in these sources that aid in vitamins. Now, next thing, let's look at the difference between essential vitamins and non-essential vitamins. All right, so we'll talk about essential vitamins. We're talking about vitamins that the body cannot produce and cannot do without. Take note, vitamins that the body cannot produce and cannot do without. Now, when we talk about non-essential vitamins, we are talking about vitamins that the body can produce in extreme condition, but may still need an external source. So, and next point, for non-essential vitamins, the body cannot produce it and must be gotten from external sources like fruits, vegetables, cereals, and all the like. But for non-essential vitamins, the body to an extent can produce. So essential vitamins include vitamin B and vitamin B complex and vitamin C, while non-essential vitamins include vitamin A, vitamin D, vitamin E, and vitamin K. So pay close attention to this. So in summary, non-essential vitamins that the body can produce; essential vitamins that the body cannot produce; non-essential vitamins that the body its source of production can be gotten either from an external source or the body can produce it. For essential vitamins, their sources must be gotten from an external site, maybe food, fruits, vegetables. Now, next thing, let's look at the difference between water-soluble vitamins and fat-soluble vitamins. Those are the two classes of vitamins which exist: water-soluble vitamins, fat-soluble vitamins. Now, we'll talk about water-soluble vitamins. From its name, we are talking about vitamins that are soluble in water, and we'll talk about fat-soluble vitamins. We are looking at vitamins that are soluble in fat. Now, the next thing we have to take note is when we talk about water-soluble vitamins, we're talking about two vitamins in particular. We're talking about vitamin B complex and vitamin C. We'll talk about fat-soluble vitamins. We're talking about vitamin A, vitamin D, vitamin E, and vitamin K. So those are the vitamins that we are talking about, and that is the difference between fat-soluble vitamins and water-soluble vitamins. Now, without much ado, let's dive into the different water-soluble vitamins. And the first vitamin that we'll be looking at is vitamin B1 with the scientific name thiamine. Now, thiamine is one vitamin that plays essential roles in the system. Now, what we need to understand about the deficiency of vitamins is that the vitamin may not be the only cause of that particular symptom. Like, for example, when we talk about night blindness, it may be attributed to vitamin A deficiency, but vitamin A deficiency may not be the only cause. That's one thing we have to take note. So there are cases where you may be taking fruit and doing all what you're supposed to do to get the vitamin, but now there is no response. In that case, you need to go to the hospital so that what is actually the problem can be diagnosed. All right, so let's go back to class. So in this class, let's look at vitamin B1 or thiamine. Now, one source or the sources of vitamin B1, you have seeds, you have nuts, you have lean meat. And now one deficiency of vitamin B1 that is very dangerous and so catastrophic is beriberi. Now we'll talk about beriberi. We're talking about the bones getting so brittle that upon the slightest pressure it can break or it can cause a fracture. Now, and under beriberi, there are two types of beriberi that we need to take note of. Now, the first one is wet beriberi, which is characterized by poor lymphatic drainage or edema, which means that with wet beriberi, there is so much swelling on the skin while the bones get brittle. Now, that case is so dangerous because most at times the people won't even know that is what they are suffering from, since as their skin is so bogus and that sort. Now, the next thing we'll look at is, the next thing we'll look at is dry beriberi. Now, when it comes to dry beriberi, the skin is so lean, so it can easily be noticeable. Now, dry beriberi means the bones become so brittle and so lean that upon the slightest pressure, it can break. That is dry beriberi. And now there is one thing that happens. Those who consume high levels of alcohol have a tendency of suffering from vitamin B1 deficiency called the Wernicke-Korsakoff syndrome. And now this Wernicke-Korsakoff syndrome comes with some symptoms. The symptoms of Wernicke-Korsakoff syndrome include mental confusion, ataxia. Ataxia means you have loss of muscle coordination. The next thing, you have ocular paralysis. Ocular paralysis means inability to control your eyeball. So these are the deficiencies, or these are the deficiency and symptoms of vitamin B1 deficiency. Now, one thing we have to take note of is that most of the sources of these vitamins are interconnected. So you getting or you consuming sources for one vitamin is definitely going to cover up for the other. Now, let's go to the next vitamin. That's vitamin B2 or riboflavin. Now, there is this symptom that is mostly common, and you notice that you have sores on your mouth, sores on your tongue. There are cases where it may be syphilis, it may be chlamydia, but there are cases where that condition is caused by a vitamin deficiency. Let's go to the next vitamin. That's vitamin B2 or riboflavin. Now, the source of vitamin B2 include, you have meat, you have milk, you have fish, and you have eggs. Now, the deficiency of vitamin B2 includes one, angular stomatitis. Now, talking about angular stomatitis, we're talking about the inflammation around the source of the mouth, which makes even opening the mouth difficult. And now we have the next symptom we have is glossitis. Glossitis means there is inflammation on the tongue. Most of the times, it's not that you eat hot food, but you just notice that for a period of time, your tongue just becomes sore and becomes inflamed. And even food, the slightest thing that gets on the tongue, is so painful. So that can be a clue that you suffer from vitamin B2 deficiency. Now, the scientific name of vitamin B2 is called riboflavin. Now, one deficiency also of vitamin B2 is that it causes photophobia. Now, we'll talk about photophobia. We're talking about an unusual discomfort that occurs when light enters the eye, since as vitamin B2 has a greater role to play in vision at the level of the eye. Now, let's talk about a particular vitamin which many people are dying for the try, because this vitamin is so important in the skin. Most of the times when they suffer from this, when they suffer from the symptoms of the deficiency of this vitamin, they tend to get all manner of supplements, all manner of soaps and rubbing oils. Let's look at vitamin B3. That's niacin. Now, vitamin B3 is one vitamin that plays an essential role in maintaining skin texture. That's one thing you need to note about vitamin B3. It plays an essential role in maintaining skin texture. Now, vitamin B3 can be gotten from a variety of sources such as milk, lean meat, undefined grains, cereals, and vitamin B3 can also be gotten from the metabolism of tryptophan. So you see that to be deficient in this vitamin, it takes a lot, and it means you have partnered with with your body to suffer from this deficiency. Okay, now let's look at this deficiency of this vitamin. It causes pellagra. Now we'll talk about pellagra. We're talking about an intense irritation at the level of the skin, which produce certain roughness, dryness, especially under the feet, and makes movement a little difficult. Now, another deficiency of vitamin B3 includes dermatitis. Now, dermatitis talks about inflammation of the skin, serious inflammation on the skin. It talks about dryness of the skin also. So you see that there are certain skin conditions that may not be as a result of sickness per se, but may be as a result of vitamin deficiency. So that's one thing you need to know about vitamin B3. And now there is a high probability of the patient developing gingivitis. Now, we talk about gingivitis, we are talking about inflammation of the gums. And now, when we talk about inflammation of the gums, there's a high tendency that the gums can get inflamed up to the point where the tooth starts falling off. So we should pay keen attention to this vitamin, as it plays a vital role in enhancing our health, the texture of our skin, and our well-being also. Now, let's go to another vitamin which is similar to vitamin B3, both from its source and its deficiency, vitamin B6 or pyridoxine. Now, pyridoxine, the source is similar to vitamin B3, excuse me. And now, the deficiency of vitamin B3 is that it can lead to rash, it can lead to skin, dry skins, irritability, anxiety, depression, and even anemia. And now, vitamin B3 at extreme level can cause menstrual irregularities. Now, I'll talk about menstrual irregularities. I'm talking about irregularities in our menstrual flow. Now, once you're experiencing these symptoms, before thinking of certain things, make sure your diet is intact so that you can get these vitamins. Now, don't forget that, okay, you can get from supplements, but natural remedies remains the ultimate goal. Now, so those are the deficiencies of vitamin B6 in particular. You have rash, you have dry skin, you have irritability, you have depression, and in extreme cases, I said menstrual irregularities. Now, let's go to another vitamin which is produced by the body. Now, at the level of the colon, we have certain bacteria that produce particular vitamin. Now, you suffering from a deficiency from this particular vitamin means that now either you have altered the pH of the normal flora at the level of the colon, making the bacteria there unavailable to produce this particular vitamin. Let's talk about vitamin B12 or cobalamin. Now, this vitamin is very important because it aids in the production of red blood cells also. So you're suffering from a deficiency in this vitamin. I forgot to make mention of this. Vitamin B6 plays a vital role in the production of red blood cells. So low levels of vitamin B6 can lead to megaloblastic anemia. Now, let's look at vitamin B12. So vitamin B12 plays a very vital role in the production of red blood cells. So low levels or deficiency of vitamin B12 also can lead to anemia. It can also lead to folic acid deficiency because vitamin B12 plays a vital role in absorption and metabolism of folic acid. And now, for pregnant women, folic acid is very important, as we'll see it as we proceed with this lesson. Now, the next thing it can cause severe nerve damage. It can cause severe diarrhea. Now, without much ado, let's go to one vitamin that is very important when it comes to pregnancy. Now, with pregnancy, you can't afford to be deficient in this vitamin if you want to give birth to a normal child. Now, research and studies have proven that most of fatal abnormalities in children and stillbirth is caused by this particular vitamin. I bring in this particular vitamin. It's called vitamin B9 or folic acid. Now, folic acid can be gotten from a variety of sources, such as green leafy vegetables. You can get it from roots, and it plays a vital role in pregnancy and also in red blood cell production. Now, when you are deficient in folic acid or folate, rather, you tend to suffer from anemia, especially pernicious anemia. You tend to suffer from anemia, and your blood and the characteristics of anemia is very simple. You have body weakness, headache, fever, and all the like. So there are some cases where you have those symptoms and it is not malaria, neither is it a UTI infection. It may just be a deficiency in vitamin B9 or folic acid. Now, let's look at the next thing, the next role of vitamin B9 that is in pregnancy, that is neural tube defect. Now, let's talk about the neural tube for some minutes. Now, we'll talk about the neural tube. We are looking at a tube that differentiates into the brain and the spinal cord, and it needs vitamin B9 to close properly so that it doesn't lead to malformation in the fetus. Now, let's look at what this deficiency of vitamin B9 can cause. Now, the first deficiency of vitamin B9 when it comes to improper closure of the neural tube, it can lead to spina bifida. Now, spina bifida is a condition wherein the tube doesn't close properly at the lumbar back, so it leads to the protrusion of spinal tissues or of tissues at the level of the lumbar back, making it difficult for proper growth of the child. And this particular condition can lead to intellectual deficiency. Now, there are cases of children who have been diagnosed from this spina bifida have been further traced to have the fragile X syndrome, which places them at very low mental cognition. Now, the next thing can lead to is deformity. The next thing can lead to is ocular paralysis or general paralysis. Sorry. So you see that deficiency of vitamin B9 is very crucial to pregnant women. Now let's look at another effect of another neural tube defect is called anencephaly. Now, anencephaly is a condition wherein the skull doesn't close properly. Now, for spina bifida, there's a high probability that you can give birth to the child. But for anencephaly, this child will die. Now, the anencephaly means the skull or the cranial bones doesn't close properly, and there's high probability that the brain is exposed. And this one thing for anencephaly, either the skull doesn't close properly or the brain doesn't form properly. Now, anencephaly, most of these babies die either in the womb or after delivery. Immediately after delivery, they die off. So you see that vitamin B9 is very important when it comes to pregnancy, and most of the times the sources are not even that expensive. So make sure, for pregnant women, make sure this vitamin is the number one priority on your list. Now, the next thing we'll look at, the next neural defect we'll look at is encephalocele. Now, encephalocele talks of the fact that brain tissue protrudes out of any opening in the skull. Now, though this can be remedied, but it is very disadvantageous as it can lead to other malformities or deformations. So these are the deficiencies or the deficiency of vitamin B9 or neural tube defects that often occurs when it comes to pregnancy. All right, now let's look at how do we diagnose these neural tube defects. Now, the reason why most of these defects happens is due to negligence, because when antenatal and ultrasonic sonography becomes a regular pattern in pregnancy, neural tube defects, it's very impossible to happen as it will be detected very early. So one thing that you can use, or one procedure, or one remedy for it, is make sure you attend antenatal regularly, and make sure you go for your ultrasonic sonography scan regularly. Now let's go to the next vitamin, that is that about vitamin B9 and neural tube defect. Let's go to the next vitamin, that is vitamin B5, also called coenzyme A. Now this vitamin helps enzymes specifically to work properly. So in the absence of this vitamin, you notice that enzyme activity in the body will be very low. Now, and one deficiency of this enzyme is the burning foot syndrome. Now, this vitamin talks about the fact that, before I proceed, the source of this vitamin, you have egg, you have liver, you have animal tissues, and you have whole grains together. Now, one deficiency of this vitamin is called the burning foot syndrome in prisoners. Now, that's when you feel a burning sensation under your feet, a burning sensation and a tingling under your feet. So that's the deficiency of this vitamin, and make sure this vitamin is number one priority on your list. Now let's look at another water soluble vitamin, that is vitamin C. Now, vitamin C, let's look at the functions of vitamin C. Now, one thing vitamin C aids in, it enhances iron absorption. So a deficiency in vitamin C will lead to a deficiency in iron, and a deficiency in iron has a high probability of leading to pernicious anemia characterized by so many other symptoms. Vitamin C plays a vital role in supporting the immune system. Now, vitamin C plays a vital role in acting as antioxidants, preventing free radicals from destroying red blood cells through oxidative stress or by oxidative stress. So you see that vitamin C has a very crucial role in the body. Now, one thing that vitamin C also does is that it facilitates collagen synthesis, which helps in collagen fibers are found at joints, which helps in flexibility. So you notice that those who are deficient in vitamin C have so many things to suffer from. Now, vitamin C also plays a vital role in strengthening the immune system. Now, the source of vitamin C are very simple. You can get it from citrus fruit. Now, citrus include grapes, limes, lemon, oranges. You can get it from tomatoes. You can get it from pineapples. You can get it from green leafy vegetables. Now, and symptoms of vitamin C deficiency is very common, is called scurvy. Now, scurvy is a condition whereby the gums become so inflamed and become so weak that they are unable to hold the teeth in place. And as such, the tooth start falling off gradually. So that is the deficiency of vitamin C. And you see that it is very important for the build-up or maintenance of the body. So that is that about water-soluble vitamins and their deficiency. The next thing we'll be looking at is fat-soluble vitamins. Now, we'll talk about fat-soluble vitamins. I made mention of the fact that fat-soluble vitamins are vitamins that can be got from an external source, but the body can still produce it since as it is from fat. So the body has various roles in which, or various metabolic pathways in which it goes through to produce vitamins in extreme conditions. Now, vitamin A is the first vitamin on our list, and one source of the various sources of vitamin A, you can get it from fruits, you can get it from green leafy vegetables, you can get it from liver meat from animals. Now, one essential role of vitamin A is vision. Now, let's talk about vitamin A and this vision. Now, you know that the rods and the cones are what aids in night vision. Now, okay, this is what happened. Vitamin A is called retinol. Now, at the level of the eye, is converted to retinal. And now this retinal combines with the chemical in the eye called opsin to form rhodopsin. Now, this rhodopsin enhances the rods in night vision. So you see that a deficiency in vitamin A is going to lead to the absence of this chemical called rhodopsin. And once this chemical is absent, night vision becomes a problem. And now vitamin A also helps in proper growth and maintenance, especially in young children, and also helps to build up the immune system properly. Let's go to the next vitamin, or let's look at the deficiency of vitamin A. Now, vitamin A, one thing is going to lead to night blindness, or under dim light, vision is going to be difficult or impossible. It's going to lead to stunted growth, it's going to lead to poor bone formation, is going to lead to low plasma, as vitamin A has been proven to be associated with cancer in recent years. Now let's look at the next vitamin, that is vitamin D, also called cholecalciferol. Now this vitamin aids in the absorption of calcium. Now one thing of this vitamin is that its deficiency and its high levels in your system also leads to problems rather. Now deficiency of vitamin B, or deficiency of vitamin D can lead to poor calcium absorption, and hypervitaminosis of vitamin D also can lead to hypercalcemia. Now, vitamin D is going to promote calcium absorption, as calcium plays a vital role in strengthening bones, production of collagen, strengthening the immune system. Vitamin D also plays a vital role in bone health, enhancing the immune system. Now, at the level of the kidney, vitamin D plays a vital role in reabsorption of calcium, because the presence of calcium at the level of the kidney is going to lead to a combination between calcium and oxalate, which is going to lead to calcium oxaluria, which leads to the formation of kidney stones. Now, one deficiency of vitamin D is called rickets. Now, rickets talks about an abnormal bending of the bones beyond which it's supposed to. Now, with rickets, you can clearly see that there's a difference between rickets and curve legs, because the bones are really bended and brittle. Now, there's another deficiency called osteomalacia. Now, this in children, when the limbs are bended and upon the slightest pressure, it can lead to a severe fracture or damage. Now, in adults, it's going to lead to another condition called osteoporosis. Now, osteoporosis talks about another severe condition in adults where the bones are bended and so fragile that can also lead to breakage. Now, vitamin D deficiency can lead to obstructive jaundice that can lead to accumulation of bilirubin at the level of the body, which can lead to jaundice, especially in the eyes. So we see that vitamin D has a very important role to play, and deficiency of vitamin D also is going to lead to poor calcium absorption. Now, let's look at vitamin E or tocophenol. Now, vitamin E, the richest source of vitamin E is vegetable oils. Vegetable oils provide us with very good sources of vitamin E. Now, vitamin E deficiency is accompanied with steatorrhea, which talks about the formation of blood in stool. And now, vitamin E also plays a vital role in enhancing the texture of our skin. So that is that about vitamin E. And lastly, we'll look at vitamin K, which acts as a coenzyme enhancing enhancing the working abilities of enzyme, aiding the body to function properly. So that is that about water soluble vitamins. With that, we'll go to the next topic, that is hypervitaminosis and hypovitaminosis. Now we'll talk about hypervitaminosis. We're talking about excessive amount of a particular vitamin beyond its normal level. That is that we are saying that the vitamin level exceeds to a very high level. Now let's take for example, and now one thing we need to know is that hypervitaminosis comes with some consequences. Let's look at hypervitaminosis of vitamin D. Hypervitaminosis of vitamin D is going to lead to hypercalcemia. And now one thing we need to understand is that vitamin D aids in the absorption of calcium. Now when vitamin D is too much, that it cannot, vitamin D aids in the absorption of calcium from the kidneys. So this hypercalcemia at the level of the kidneys is going to lead to kidney stones in the long run, because calcium is going to combine with oxalate, leading to the production of kidney stones. So you see that hypervitaminosis has its own effect. Now let's look at hypovitaminosis. Now hypovitaminosis is what we have been talking about throughout this lesson, wherein the amount or the levels of vitamins is very low and it comes with its defect. So what we have to understand is that we have to make sure our vitamin levels are in check. Now, for science students which are watching these videos, there are cases where patients will come to you, and this knowledge is going to be of a very vital help to you. Don't forget to like, don't forget to share, don't forget to subscribe. See you in our next lesson, wherein we'll be talking about enzymes.